We are so pleased to welcome today Sarajane Williams. Sarajane is a licensed psychologist, harpist, composer, author with over 50 years of experience in the healing arts, former nurse and cardiopulmonary technologist, director of a cardiac catheterization laboratory, biofeedback therapist in a chronic pain center. Sarajane is also editor of the Harp Therapy Journal and founder of the Vibroacoustic Harp Therapy program. So, welcome, Sarajane.
Greetings, Marianne. Thank you very much for inviting me to be part of this amazing conference. You, Sylvia, and your team have done a wonderful job of organizing this international group of harp therapists who have done so much to instill the therapeutic use of the harp in pedagogy, as well in research, professional, clinical, and transpersonal settings. I'm deeply honored to be included today and am in awe of and thankful for the important work that's being done. I've met so many lovely people through this journey with the harp and through the Harp Therapy Journal. Unfortunately, I'm not joining you in person today, but please know that I send heartfelt greetings and appreciation to all of you who are carrying this collective work forward. I've always loved the harp, but during childhood I studied piano and a little French horn instead. However, 45 years ago, my first harp lesson was transformational. When I walked into Dorothy Canalsa's harp studio, it felt as if I was ushered into a world of incredible beauty. When I sat behind her gold pedal harp and touched the strings, it seemed like the whole room began to pulsate with light and sound, and I was flooded with surreal sensations. I knew that's what I had to do the rest of my life, and I didn't care if I could only play a simple tune by the time I was 90. I had never had a reaction like that to music before and wondered about the harp's healing potential. As a student of psychology at the time, I began to research the legacy and science of the harp as a healing instrument and wondered if other people had similar transpersonal experiences. During the early 1990s, I was fortunate to meet some pioneers in the emerging fields of sound therapy and cymatics who helped to broaden my understanding of the potential benefits of the timbre of the harp. This all occurred before the days of the internet and Google, but I eventually compiled the collected data on our first personal computer, which used floppy disks and had a green screen. And a few years later, the Mythic Harp book was published as a resource for others who might be interested in the archetypal power of the harp. In 1989, while working as a biofeedback therapist in a chronic pain center, I used a Genesis bioentrainment unit. It consisted of a large metal cuboctahedron frame that supported a suspended platform with audio and sub-audio transducers and acoustical and biodynamic field sensors. It was attached to a control console that housed a computer, synthesizer, digital signal processor, mixing console, cassette player, and compact disc player. One of my roles was to provide pre-recorded music sessions via the Genesis module located in a dark, soundproof room. However, I began to feel like a disc jockey instead of a musician because my musical choices were limited and my personal touch was missing. So one day I took my pedal harp to work and plugged its pickup into the console's microphone jack. Miraculously, the harp was amplified through the system without any technical difficulties. After performing a few trials with coworkers and patients, I found that each note of the harp would resonate in a specific area of the patient's body, and each person's response was unique. That marked the beginning of what later became known as vibroacoustic harp therapy. I went into private practice in 1991 and began to use a portable massage table that was embedded with speakers to offer VAHT as an adjunct to psychotherapy and treatment for patients with chronic pain, and then documented the results. Over 50 harpists from around the U.S. and Canada attended the first International Healing Harp Symposium, which featured Dr. Ron Price, founder of Healing Harps, Linnell Ediger, director of the Richmond Public Schools in Virginia, music therapist Mary Scoville, and neurologist and acupuncturist Dr. Robert Rochman on November 4th to 5th, 1995 at Shepherd Hills Country Club in Allentown, Pennsylvania. By this time, the seeds of the age-old and transpersonal use of the harp for healing had been stirred in the collective consciousness by a few harpists such as Joel Andrews, Therese Schroeder-Sheeker, Christina Turin, Laurie Riley, and Ron Price, who recognized that the harp provided a special kind of solace. There was a yearning amongst the harpists to develop their therapeutic harp practices to honor the body, mind, emotions, and spirit. At that time, traditional music therapy programs required in-person attendance and included only piano, guitar, or voice in their training, which embraced a traditional medical model. The first classes of IHTP and MHTP had just recently been offered. The internet and email were becoming available to people who had personal computers. My husband Ted had already established our website to begin sharing information on a wider scale, and the need for an informational and networking tool became apparent, so seeds for the Harp Therapy Journal were sown during the symposium. When I coined the term harp therapy around 1990, some people laughed and others thought the word therapy was inappropriate. However, the term gained use as therapeutic music training programs, and particularly the International Harp Therapy Program, were developed over the next few years. Throughout the late 1990s, the word spread as presentations about harp therapy and vibroacoustic harp therapy were featured at harp and sound healing conferences, colleges, hospitals, integrative health expos, as well as on TV and in magazine articles. Initially, there was a perceived rivalry between some training programs and concerns regarding what was being taught and client safety. However, a group of program directors met to dispel rumors and to begin the process of establishing mutually agreeable standards of practice and professional conduct to establish credibility in the emerging new field. Beginning in 2004, a national certification board was established. Members met regularly via Skype phone calls and sometimes engaged in intense debates over the use of just one word. They addressed the commonalities and differences among training programs and also had to define the difference between music therapy and therapeutic music offerings. After establishing bylaws and the scope and standards of practice for therapeutic musicians, the National Standards Board for Therapeutic Musicians was incorporated in 2007. The NSBTM certified training programs, while each training program certified its own graduates. By 2008, 4 accredited training programs were approved, and also in 2008, several NSBTM founding members met with representatives of the American Music Therapy Association to dispel misunderstandings, define roles, and collaborate to meet a wider range of patient needs. Today, most hospitals and hospices in the U.S. now recognize the role of therapeutic musicians and typically require that they are certified to work at a facility or at outpatient settings. The NSBTM has dealt with restrictive legislation in a few states to allow TMs to practice. However, there has also been increased collaboration between music therapists who supervise TMs within those settings. Some hospitals' pastoral care offices oversee TMs who provide bedside services, and moreover, some TMs have become chaplains to provide a wider reach. The harp continues to play a significant role in palliative care, music thanatology, and end-of-life vigils. In addition, some Canadian TMs have been providing services during medically assisted deaths. TMs with specific licenses and certifications, such as a psychologist, occupational therapist, or nurse, might provide services in private practices or under the auspices of organizations such as visiting nurses or a church's community health service organization. In addition, TMs are now providing their services and expertise in corporate and wellness offices, at yoga studios, and in research and academic settings. After beginning this work around 1989, I learned that Norwegian researcher Olav Skilla had been providing vibroacoustic therapy by using recorded music delivered through a vibrotactile device. He had embedded specific low frequencies produced by a tone generator into the musical recordings to treat specific medical issues. While witnessing a variety of responses to specific notes plucked on a harp, I found that the full frequency range of the harp's analog and amplified sound could elicit a wider range of vibrotactile and emotional responses than had been described in the VAHT literature. VAHT utilized low-frequency sound in the 30 to 120 Hz range, which stimulates the denser tissues of the human body, whereas VAHT's full-frequency application was shown to typically elicit vibrotactile responses within the 30 to 440 Hz range. However, some sensitive clients perceive vibration as high as 2 octaves above the normal 440 Hz range, within the body or outside in the energetic field. Synesthetes also reported perceiving colors, shapes, or scents when specific notes were played. The outcome of most VAHT sessions revealed reduction in pain and tension, a feeling of deep relaxation and nurturance, and improved mood. And in some rare cases, clients reported complete recovery from paralysis and chronic pain and significant psychological insights after receiving VAHT. A concert harp is the premier instrument for vibroacoustic therapeutic music. A plucked string produces a sawtooth waveform filled with an almost infinite number of harmonics and a long decay. Clients often liken the vibrotactile sensation of tension and release to that of a musical massage. The full range of strings allows for a full range of potential responses. Moreover, the harp's ancient and archetypal legacy as a healing instrument can immediately open doors for trust and inner exploration. Of course, the presence of an interaction with the therapeutic harpist can play a significant role in VAHT. The harpist's intention, technique, tone, personality, sensitivity, and knowledge can affect entrainment, the musical delivery, and the client's receptivity and processing of any experiences during the session. As a new therapy, VAHT was initially offered as an experimental session to friends, families, and a few long-term clients to document and analyze the effects. I waited a while until I had sufficient data to feel comfortable enough to provide VAHT in my solo psychology practice as an optional adjunct to therapy. The response to VAHT was very positive, and I published anecdotal results. However, I felt that controlled studies were needed to advertise the therapy to a larger audience. Despite numerous attempts to introduce VAHT into local hospital settings, the therapy was too new to be embraced during the 1990s. However, I received IRB, Institutional Review Board, approval in 2006 and 2014 at 2 local hospitals to perform controlled studies. However, both were never completed due to funding and management changes on the units. VAHT program graduates have been successful in providing VAHT in hospital and clinical settings, such as palliative care, during in vitro fertilization procedures in nursing homes, primary care settings, respite care, and for employees at several medical centers. When I first began doing this work, I envisioned a future scenario where a computerized holographic resonance and biofeedback map of a client's body and energetic field would provide suggestions to enable a VAHT practitioner and clinician to direct the best live music interventions for the client in real time. With the advent of AI and many new technologies, this vision is now becoming available. Harp therapy has already become adopted as a respected modality in a variety of clinical settings. Currently, VAHT is at a transitional stage between a niche therapy and evidence mainstream treatment. VAHT's specialized branch of harp therapy combines the use of a vibrotactile device with live human interaction, the harmonic resonance from the strings, and subtle tactile vibration through the body, thereby making it more of a relational or expressive therapy rather than a mechanical treatment. Moreover, the harp's sound profile with rich overtones and a long decay naturally supports parasympathetic activation. This alignment with the growing interest in polyvagal theory, somatic therapies, and nonverbal trauma processing potentially indicates increased use alongside psychotherapy for PTSD and complex trauma, and increased use in hospitals and mental health clinics. In the mainstream medical arena, larger clinical trials, particularly regarding chronic pain, anxiety, PTSD, insomnia, depression, and neurological disorders, will be needed to strengthen the evidence for possible incorporation of VAHT into clinical guidelines. So such studies will likely measure changes in heart rate variability, EEG, and cortisol and stress biomarkers. In addition to funding for research, targeted interest and funding for the development of standardized equipment to perform the research will be needed. Technology integration will undoubtedly occur through machine learning and biosensing, resulting in AI-driven personalization. Once evidence-based studies demonstrate efficacy, we will likely see the expansion of vibrational therapy such as VAHT into neuroscience, brain-based therapies, non-drug mental health treatments, neurorehabilitation, and physical medicine as a legitimate non-invasive neuromodulation tool. However, VAHT could remain a complementary therapy, even without full medical validation. Growth in the wellness market to provide stress reduction, sleep optimization, and enhancement of meditation will continue to be consumer driven. Future hybrid treatments could incorporate light and sound to address multisensory systems. The benefits of vibration therapy have also been documented through the uses of VAT, or vibroacoustic therapy, for mechanical regulation, vibration plates for muscle and skeletal stimulation, and tuning forks for localized stimulation to targeted areas. VAHT provides emotional and sensory experience and integration. Auditory, tactile, and emotional input of a plucked string's rich harmonics stacked on phonometals are delivered via airborne and vibrotactile contact during a VAHT session. Even the overtones of low notes carry mid and high frequency information, which have been shown to induce strong physiological effects. The broad spectrum harmonic vibrations within a constantly shifting wave field are perceived as coherent and organized. As a result, strong engagement of the nervous system is also felt as immersive, regulating, and emotional. Moreover, the VAHT practitioner's presence, technique, and intention affects the client's nervous system via pattern recognition, emotional processing, and a sense of safety. The physical presence of the musician helps to shape the listener's subjective experiences and physiological responses, particularly heart rate. Live music has been shown to affect significantly higher activity in the brain's amygdala and broader neural network related to heightened emotional responses in listeners than recorded music. The analog sound of live harp music, which contains all harmonics, is typically perceived as warmer and more emotional than digitized sound, which contains only odd harmonics. Digital music may be precise and practical, but it can lead to quicker listening fatigue, especially at high volumes. Therapeutic music programs typically provide guidance for professional development, so many tools for success, like memorizing a succinct elevator speech, have already probably been presented. Networking, partnering with other professionals, and marketing are essential to building your professional practice. Organize your marketing materials and document the efficacy of your therapy. Do research and write articles. Cross market in community groups and look for media opportunities to advertise your work. The field of harp therapy is not corporate driven, so its growth largely depends on independent practitioners, training organizations, and integrative health centers. It's also important to stay true to your personal style and energy level while developing new skills and maintaining good technique. Self care is essential. Above all, acknowledge your inner light, honor your heritage and Mother Nature, and be of service for the highest good through your music, creativity, joy, compassion, knowledge, and encouragement of others. Harp therapy may have a unique role because string resonance naturally bridges acoustics, vibration, embodiment, and emotion. All of those elements are worthy of future research. Harp therapy could eventually fall under an umbrella of vibration specialists that incorporate subtle neuromodulation through vibration. There will be many scientific breakthroughs within the next decade or two. For instance, mechanical vibrations called phonons travel through atomic lattices and carry quantum information at the speed of sound. Viable interconnects within quantum computers will provide an entirely new physical pathway for quantum communication and computation. A plucked harp string vibrates at 10 or 11 dimensions at frequencies up to 20,000 hertz. As our understanding of quantum mechanics unfolds, we might better be able to understand how musical intentions can be delivered just a thought away, such as in distance healing and interspecies communication with the harp. Harp therapy practitioners will bridge the science and spirit language gap through their evidence based practices, while continuing to honor the ancient legacy of the harp as a spiritual and healing instrument. The harp will continue to be used for social engagement in spiritual practices, in harp circles for performance, and for inner exploration. Most harp therapists are drawn to this work for inner development and with a wish to be of service to others as well as to the larger community. They will continue to provide collective community support and solace, especially during and after disasters. Analysis of the harp's sawtooth waveform will aid in greater understanding of string resonance and human tissue interactions. Sawtooth waveforms represent rapid changes in physiological signals often seen in heart rate or brain activity. They typically produce a broader frequency range affecting muscle activation patterns, in contrast to square waves, which contain only odd harmonics and are produced by digital music. One study distinguishing between major and minor modes did not produce markedly different effects on alpha brainwave activity or reaction time, suggesting that the harp's timbral properties may exert a relaxing or emotional influence that overrides emotional nuances typically conveyed by modes. The specific effects of the timbres of various instruments will also aid in the development of biofeedback and neurofeedback therapies. New technologies are currently aimed at weaving together precision frequencies, melodic structures, and harmonics that align with an individual's real-time EEG recordings, thereby guiding the brain waves toward a therapeutic state. New modalities for music delivery, such as through the use of personal, portable, and virtual reality devices, are also being developed for entry into a metaverse where digital and physical experiences blend. In the near future, virtual visits with a clinician will be conducted via holograms, allowing patients to beam in for an interactive, lifelike consultation just using a phone. A harp teacher or a therapist could appear as a holographic presence with tactile feedback in a variety of settings. As vibroacoustic therapy is moving toward personalized protocols, haptic interfaces are becoming much more sophisticated. They could include smart vibroacoustic garments, resonance vests for emotional regulation, or sensory-rich therapy mats or healing cocoons. Future clinicians might adjust patients' personalized music parameters rather than prescribing higher doses of medication. However, there are concerns that automated musical interventions might reduce the importance of human relationships in therapy. The convergence of vibroacoustic therapy, harp therapy, holograms, and haptic sensors could become a major frontier in multisensory healing. And within 20 years, multisensory holographic healing environments could become a reality. Thank you again, and keep up the great work.